In, out. It's what keeps you alive. But when your breathing stops, the countdown begins. And while every second counts,
Suction ready.
you won't see these paramedics frantically rushing around, not in Williamson County.
BVM,
Here,
HME,
the tortoise wins the race.
Entitle.
Since the start of 2016, paramedics began using a new technique when intubating patients.
Our success rates went up dramatically.
The difference is in the name. It's called delayed sequence intubation versus the industry standard rapid sequence intubation. EMS Medical Director Jeff Jarvis says critically ill patients with respiratory issues, often the elderly, can't tolerate low oxygen levels for very long. Same goes for trauma patients, often a problem with younger people.
Their risk of dying doubles with even one episode of what we call hypoxia or low oxygen levels.
The typical process of putting a tube into their lungs right away most times does lower levels. That's why the new method
I've got a stopwatch.
delays intubation.
I'm gonna go ahead and start the 3-minute clock.
First, paramedics give the patient a sedative,
200 milligrams of ketamine.
but just enough to relax them.
Oxygen ready.
Then they give the patient oxygen.
To create a reservoir or a buffer in their lungs.
We'll maintain this for 3 minutes.
Paramedics spend several minutes pumping up the lungs. Think about it like helium in a balloon. If the patient is at capacity before intubation, rather than struggling to breathe, well, then they're less likely to drop to a dangerous level when intubated.
This will take the patient's breathing away.
Paramedics then give another sedative, this time to paralyze the patient, then begin intubation.
We look for the epiglottis.
The tool used for intubation comes with an attached camera, leaving less to chance.
Now the tube is going between the vocal cords.
Jarvis says using the combination of video and the slower, delayed technique is unique to Williamson County, and at least 30 people just this year remain breathing in and out because of it. So it's safe to say this is saving lives.
I absolutely think it is.
Sarah Navoy, KI TV News.